Dropsy, deadly disease. 90% will die. Only a few are lucky to get well again. What is dropsy? Where did it come from? How to cure it? How to avoid it? Many know that dropsy happens because the presence of excessive fluid on the inside of the fish body. So make fish become swollen, push scale to stand up. Then various treatments are carried out. Some use aqua salt, antibacterial, antiparasitic, Epsom salt, even katapa or Indian almond leaves. But all of them did not bring result. Why? Because all the treatment mentioned above, none can cure it, not even reach the target. All of the above treatments are external, while dropsy is an internal problem. Causes of dropsy: genetic, food, water condition. For genetic problems, there is nothing we can do. But for food factors and water conditions, we need to know how the process happened, so that we understand what and how dropsy really is. All living things need food for survival and interact with the air around it. In aquatic life, this means interacting with the surrounding water. Food that is eaten by fish, before being absorbed and carried by blood to be distributed throughout the body, will experience the digestion process first. The liver is the most important organ in this regard. Of course, a good food will not harm liver function. Some cheap quality food need to be adopted and watched out for, especially hard food, and many contain additional coloring agents. If the heart does not become damaged, maybe a lot of dangerous substances missed when processed by the liver, and everything will end in one place, namely disposal. But keep in mind, there are two things that disposal: feces and urine. Does the fish pass urine? Yes, of course. All living things pass urine, namely in the form of fluid that are not needed by the body. So does fish. Water entering the mouth into the digestive tract and water entering through the body's osmotic pressure, all processed through the kidneys, and will be issued in the form of urine, through urine pores or through gill. Saltwater fish mostly pass urine through the gills, but freshwater fish more through urine process. What happens when there is rotten food, which is processed into the kidneys, or harmful substances in the water has entered and damaged the kidneys? All form of cell life, if experience damage, injury or rot, even having an infection, will be the main target for all bacteria and parasites. They eat and thrive here. These internal bacteria and parasites, causing kidney malfunction. The kidney fail to send dirty fluid to be removed from the body, but this liquid comes out in the body, meets the fish body cavity. Swollen fish body and the fins will start to stand up. The more fluid in the body, the stronger the pressure on the fins. External medication are not able to reach to the kidney area. An Epsom salt that works compress the swelling and stimulation to excrete will not be able to compensate accumulation of liquid produced. Because the source of the problem is not treated, we need medicine that are able to enter the internal area. And this medicine must be antibiotic until there is continuity of treatment, until the kidney recovers and returns to normal. Metronidazole is the best antibiotic because it will treat infections and clean bacteria and protozoa as a whole, which is in the body. But the difficulty is metronidazole cannot be absorbed by the body. So to be able to enter the body, need to be given together in fish feed. And further problems arise, which is the fish are reluctant to eat when in a state of illness. Vitamins. Giving vitamins can be done in order to help stimulate the fish's desire to eat. The vitamins needed are A, B, C, D, E, and K. Vitamins become less effective when exposed to bright light. Should be given at night when the lights are turned off and before the fish sleep, so that absorption of vitamins can run better. Besides metronidazole, there are 3 other external medicines which can be absorbed by the body to reach the central area of damage. Those are Canaplex, tetracycline, serabactopur direct. Serabactopur direct is not traded in America. I don't know why. While tetra can be obtained at pharmacies, made in capsule form, but it should be noted because there are 2 forms of packaging. Contains powder and paste. Avoid packaging containing paste because there is an effect of making oily water and make water murky. So the fish have difficulty breathing. Canaplex. 30% of the active ingredients used is kanamycin. Can also be obtained at pharmacies. For those of you who use medicine directly from the manufacturer, can read the instruction for use. But for those who buy from a pharmacy, note the following doses. Prepare a quarantine container, fill at least 3 liters of water, or multiple, adjusting to the size of the fish, and so on. Use water that has been dechlorinated. Now assuming the water used is as much as 3 liters. Weight 5 milligrams of an antibiotic. Use a digital scale with a milligram scale. For tablet form can be crushed into powder, while the powder form can be weighed directly. Put in a glass of water. Add half teaspoon of aqua salt. Stir and pour evenly into the quarantine container. Do not use filter. Must use an aerator and heater. For 3 to 5 liters, use a 50 watt heater. 5 to 10 liter, use 75 watts. Above 10 liter, use 100 watts. After 24 hours of treatment, change the water partially. Repeat treatment until the fish recover. There is no limit to how long the treatment will take. Fish begin to heal marked by cessation of swelling on the body of the fish and already want to eat as normal. Ignore the scales that are still standing. Scales will return to normal in a very long time. Just a little sharing about Dropsy hopefully can help understand and be a little clearer regarding these deadly things. Dropsy is not a disease, but it is the effect of a bigger problem in it, so we can focus more on the real target. See you in my next sharing. Thank you.